we've been telling you this morning, new data shows a disparity in who is getting the COVID vaccine. The pandemic is also highlighting racial disparities in overall health care among communities of color. And there is one specific area where Black women face the most risk, and that is maternal health. In New York City, Black women are 12 times more likely than white women to die of pregnancy-related causes during pregnancy, according to the Department of Health. Nationwide, CDC says Black women are 3 to 4 times more likely to die from pregnancy complications than white women, and there is a lack of resources for women of color to turn to for help.
I suffered a postpartum hemorrhage after the birth of my oldest daughter in 2010, and I almost died shortly after the delivery. 13 months later, I had a miscarriage in public. After that happened to me, I just kept really thinking to myself, okay, I've survived this now 2 times in a row within 13 months. And I just hadn't heard people talking about maternal birth traumas, maternal health, pregnancy complications, birth complications.
On Capitol Hill are taking action to address these inequities with the Momnibus Act of 2021. What is that? Well, let's get into it. Joining us now this morning is OB-GYN Dr. Kameelah Phillips, founder of Calla Women's Health on the Upper East Side. Dr. Phillips, thanks for being with us.
Thank you so much for having me. This is such an important topic, and I really appreciate you guys addressing it.
Absolutely. It's very important. And as we heard from Tamoria Saba in that piece there, share her experience, have you heard many similar stories from your patients?
Oh, absolutely. Maternal health and the crisis in this country is something that I deal with every day. From pregnancy loss, preterm delivery, hemorrhage after a delivery, and even preeclampsia. These are all issues that Black women are facing in a disproportionate rate. So I deal with this every day.
I experienced preeclampsia during my delivery, so I completely understand the risk here. The Black Maternal Health Momnibus Act, though, let's talk about that because it was introduced last week, focuses on 12 key areas to address these inequities. Given that you're on the front lines treating women of color every single day at your practice, which areas do you think should really be prioritized here?
Well, one area that I think should be prioritized is our focus on social determinants. And these are basically factors of how we live, where we eat, where we go to school, where we get our food from. And these determinants for many communities of color are vestiges of policies as they related to slavery, Reconstruction, and Jim Crow. And these policies continue to help to prevent us from meeting our maximal health wellness. And so that's one issue that's going to be addressed. The other that I think is really important is that it aims to diversify medicine. Right now, Black women are about 2% of doctors, but in general, in the community, the African-American population is about 13%. So we really need to diversify our medical field when it comes to doctors, midwives, doulas, so that we can serve a more diverse America.
Diversity is one thing, but is there an implicit bias in the medical field, which also needs to be addressed here?
Absolutely. And we've been hesitant to talk about it for a while, but the word is out. We are dealing with implicit bias in medicine and, frankly, medical racism that really needs to be unlearned. And it is impacting our delivery of care, our engagement with patients, and really part of this maternal health crisis.
Let me stop you right there because I want to understand this racism when it comes to getting the types of treatments that women need, especially maternal health. Help us understand some examples of that.
So I've had many examples of patients who, for example, I tell them if your blood pressure is over 150 over 90, 140 over 90, or if you have a headache, visual changes, I need you to come back to the hospital and be evaluated. I've had patients report that they come to the hospital on my orders with elevated blood pressures, and instead of being admitted, are simply sent home with aspirin. That's not appropriate. And so the understanding that Black women need to be listened to, that their needs need to be taken seriously, is all part of dealing with our implicit bias and medical racism. I hear these stories from all over the country.
All right. In the interest of time, though, I don't want to run out of time, but I want to get to something that's very important, and that is mammograms and vaccines. Some people don't understand how the vaccine can actually affect your mammogram. So walk us through that.
So most recently, we've seen after the COVID vaccine that it can activate your immune system and specifically your lymph nodes in the underarm. And when you have a mammogram, it also captures lymph nodes in your underarm. So we currently recommend that you get your mammogram either prior to receiving your COVID vaccine or waiting 4 to 6 weeks after, so that these enlarged mammograms aren't a worrisome sign for cancer.
That is very important information, because the last thing you want to get is a false positive, right, on a mammogram, because that can send you into a whole host of worries. Dr. Kameelah Phillips, very important information that you're providing us today. Thanks for being with us.
Thank you for having me. Enjoy your day.
Absolutely. You too. Stay well.